Welcome to our first video update on enhancing junior doctors' working lives. This programme is a key area of work at Health Education England, and since 2016 we've used it to tackle a range of issues affecting the lives of junior doctors. The unprecedented challenges and disruption caused by COVID-19 have affected us all, but this upheaval has also highlighted the need and the opportunity to improve the way we work and the systems we have in place. We believe meaningful change can be achieved through cross-system collaboration and listening to feedback. This video has been created and directed by trainees for trainees to share key progress from the Enhancing Junior Doctors' Working Lives programme. In this video, we will hear about flexibility in training, medical education reform, trainee engagement and well-being. More details can be found in this year's full report. Let's hear from Ross, a member of our HEE team, for some updates on flexibility in training.
Doctors in training have always spoken about the positive impact of flexibility, which we believe to be more important now than ever before. We're committed to making sure that flexible options will be more readily available and supported for all trainees in all specialties, especially as we recover from the demands of the COVID pandemic. For this, we've expanded the availability of less than full-time training without the need for eligibility criteria, called Category 3 less than full-time. We've also piloted an out-of-programme pause offer, allowing trainees to step out and back in of training programmes flexibly. Your supervisors and HEE local offices should have more information, and further details can be found in the full report.
The pandemic has understandably placed considerable strain on everyone in the health service, and it's really important that we prioritise the health and well-being of all of our doctors in training. This applies during the post-COVID recovery phase, but also extends far into the future. Here's Dr. Fung to tell us more.
The issue of mental health in the workplace has never been more important, and we will continue to prioritise the well-being of doctors in training in our efforts going forward. We've really listened to our learners who have been struggling, and we really want to help. We've developed a suite of resources in the form of leaflets and videos that have been created by trainees for trainees, but we know there's still more to do. We also recognise that supervisors play an important role in trainee well-being, and that it's vital that they're able to compassionately help their learners who disclose a mental health problem. We're providing additional support to our clinical and educational supervisors who would like to feel more confident in dealing with these sensitive issues. We've also introduced the Wellness Induction. This is a 30-minute wellbeing meeting offered to all NHS learners. A trained NHS wellbeing champion will provide the opportunity for reflection during the first 2 to 4 weeks of a new placement and outline all of the support available to the learner should they need it. These wellness inductions are available via video call or face-to-face.
Adaptability and innovation in education are key to ensuring junior doctors are trained for the needs of tomorrow. The future of medical education is a fascinating yet challenging one, and it's our task to shape and reform it with our doctors in training. Here's Dr. Joe Schramm, a consultant respiratory physician and clinical advisor at HEE, explaining more about our Enhancing Generalist Skills programme, a part of the Medical Education Reform Initiative.
We saw during the pandemic how important it was to respond to patient and service need, and also to work with the communities now to recover from that very difficult time. So we'd really appreciate your help. We're looking to co-create a programme that will put your professional development at the heart of what we do within training. This programme will really look at local health needs and priorities, so it will have a regional flavour. I'd encourage you all to talk to the people working around you to find out what needs there are, thinking about things like health inequality and also the passions that you have in your own training. So have a read of the report and find out how to get involved.
At HEE, we're always looking to improve the way we listen, work and connect with our trainees. Some of the ways we engage include regional and national surveys, forums and in-programme involvement. Let's go to Vidushya and Reis, both trainees and clinical fellows at HEE, to hear more about the new National Trainee Engagement Forum.
During my fellowship here at HEE, we've really felt the need to widen the reach and access to the frontline trainee perspective, and HEE saw significant value in that too. That's why we launched our National Trainee Engagement Forum, the NTEF, which brings together regional HEE trainee reps from across the country to form a grassroots trainee community. This inter-regional collaboration has been a really helpful tool to share best practice and solutions, but crucially, the NTEF has also created and strengthened a dynamic link between trainees and HEE's senior teams.
The NTEF also aims to bring the perspective of our trainees and multi-professional learners to wider system leaders, those who make policy decisions and lead the health system. To do this, the NTEF are proud to host our Insight events. These are stimulating, inclusive events designed to really encourage some blue sky thinking. Most recently, we discussed what will medical training look like post-COVID, and also how can HEE and trainees help address health inequalities. Feedback shows these events really spark conversation and highlights the importance of us all truly working together. So, we hope to see you at our next one.
It's been a year of huge challenges in which significant improvements have been made. However, there is still much to be done to ensure we have a valued, healthy, motivated and empowered clinical workforce. I'd really urge you to read the report and think about how the initiatives can help you. This is an evolving process and we're really looking forward to working with you on the Enhancing Junior Doctor Working Lives programme. Thank you.